Welcome to my channel. For the purpose of conception, both husband and wife have an equal role. As it is necessary for women to have normal ovulation for conception, it is also necessary for men to have a normal sperm quality and quantity. If a man has problem with sperm quality, it can lead to difficulties conceiving. To determine whether a man's sperm is normal, a doctor performs a test called semen analysis test. Through this test, it can be understood how capable a man is of fathering a child. Many people on my Facebook page and in the video comment box want to know about the semen analysis test report and whether there are any problem indicated in the reports. So, in this video, I will discuss about after looking at your semen analysis test report, how do you understand whether your semen analysis report is normal or abnormal, or will you have any problem taking the baby? Before conducting this test, there are a few important things to keep in your mind. If you don't follow the correct procedure, the test report may not show accurate result. So, it is essential to pay attention to this point before undergoing the test. Number 1. Decide where you will perform the test. You can go at any reputed hospital or pathology lab and ask for a semen analysis test. If you have doubt about the capabilities of a small clinic or its equipment, it's better not to test here. If the machine or hospital personnel conducting the test are not proficient, the semen analysis report may not be accurate. Avoid any sexual intercourse or masturbation for 4 to 5 days before the semen analysis test. If you have the test done on a specific day, make sure to abstain from sexual intercourse or masturbation for 4 to 5 days leading up to that day. At the hospital, you will be provided with a container for collection the semen. Collect the semen in that container and deliver it into the hospital. You can also collect the semen at home using masturbation as the method. However, make sure to deliver the semen to the lab within 30 to 60 minutes. Otherwise, the result may not be accurate. By following this guideline, you can ensure your more accurate result for your semen analysis test. Afterward, the report will be generated. Now, in the report, it will contain various substances and their respective normal and abnormal ranges. Each subject will be discussed in detail from start to finish, inshallah. Please continue watching the video for a complete understanding. Here, one thing needs to be clarified. Semen and sperm are not the same thing. In a man, semen approximately 90% consists of various fluid substance, while 10% consists of sperm cell or spermatozoa. The various fluid substance and sperm cells together are referred to as semen, and sperm cells are the component of semen. To understand the report, we will directly discuss it. Here is the patient's basic information. Below is the semen analysis test. Firstly, the basic information in the report is ejaculatory abstinence period 7 days, meaning the number of days of sexual abstinence or avoiding masturbation before the semen test. It indicates that the person did not engage any sexual activity or masturbation for 7 days before the semen analysis test. Method of collection: masturbation. The semen sample was collected through masturbation. Sample collected at hospital. The individual brought the semen sample to the hospital. Number 2 is microscopical examination. First, there is the volume, which indicates the amount of semen released during ejaculation. As per example, the amount of semen on you provided for the test. Here it is written as 2 ml. Normally, during each ejaculation, a man releases about 2 to 6 ml of semen. The average is around 3.5 ml. Since it's mentioned as 2 ml, it's considered normal. However, if someone has less than 2 ml of semen, it's referred to as hypospermia. Hypospermia means a low volume of semen, which can lead to difficulties conceiving. After this, the point is viscosity. Somewhere it is written liquefaction, which means the rate of transition from thick to liquid consistency of semen. When ejaculation occurs, the semen looks like a gel, but within 20 to 30 minutes it becomes fluid like water. Here it is written liquefaction 20 minutes, meaning it takes 20 minutes for semen to transition gel-like consistency to fluid. It's normal. Many people think that if semen become thin, there will be problem conceiving. It is not true. Generally, due to substance called leukocyte present in the semen, it takes time for semen to become fluid. Normally, within 20 to 30 minutes of ejaculation, it does not have a high density. It becomes thin, and that's why it is easier for the sperm to swim. Now, if it takes more than 30 minutes is called hyperviscosity, and the meaning of hyperviscosity is increase the rate of infertility. Here it is written 20 minutes. The report is normal. Number 2 also refer to the pH of the semen. By determining the pH, we can determine if the semen is acidic or alkaline. Normally, the pH of semen range from 7.2 to 7.8. If the pH level is low, it indicates higher acidity, and if the pH level is higher, it indicates alkaline. Here, the pH is 7.2, which is considered normal. However, if the pH of semen is significantly lower or higher, it can lead to problem of sperm quality and quantity and increase the chance of infertility. Number 3 states semen concentration, and this point is very important. Normally, in a healthy man, the quantity of sperm per ml of semen is around 20 to 200 million. On average, it is 120 million per ml. In the report, there are 30 million sperm per ml of semen. Therefore, this report is considered normal. Now, if the quantity of sperm in the semen is less than 20 million of per ml, it is called oligospermia. And if oligospermia is present, there will be a problem conceiving a baby. According to the World Health Organization, if the quantity of sperm per ml of semen is more than 200 million, it is called polygospermia. In many cases, polygospermia does not pose a problem. After that, you see the total count of sperm, which means that regardless of the semen volume, it indicates the quantity of sperm. Generally, during each ejaculation, a male releases approximately 40 to 1000 million sperm. On average, it is 400 million. Now, if someone releases less than 40 million sperm during each ejaculation, is also called oligospermia. And if that happens, it indicates an increase the rate of infertility. In this report, it states that the total count of sperm is 60 million. It is considered normal. After this, the point is sperm motility. It indicates how much movement the sperm can perform. Sperm travel through the female reproductive tract, crossing the fallopian tubes to fertilize and result in pregnancy. There are two aspects here. Firstly, progressive motility. That means when a sperm moves in the straight line, swim through the fluid. Reports show that 25% in healthy semen, but it must be more than 32%. Secondly, non-progressive motility is 5%. Total motility is the sum of progressive and non-progressive motility. In healthy semen, total motility should be greater than 50%. Here, the total motility is 30%, indicating a problem in the report. Note that in this case, non-motility refers to 70% of sperm being unable to move properly. It's meaning that sperm are incapable to meet with the egg. Each sperm swims through approximately 25 micrometer per second. If sperm motility is low, it can lead to difficulties in conceiving. If your sperm mortality is less than 50%, the report comment or impression will state asthenospermia. Asthenospermia means there will be difficulty in conceiving. After this, we observe viability, and the meaning of viability is number of live sperm present in the semen. The semen remaining viable in the female reproductive tract for 3 to 5 days after sexual intercourse. In healthy semen, the amount of viable sperm should be greater than 70%. If it is less than 58%, it may be cause infertility. After this, an essential point follow, namely morphology. It determines the health of the sperm. For this, we need to identify normal healthy sperm morphology. In the image, you can see a sperm with a prominent part of the upper side called head. This part crucial for the fertilization process. It contains the mitochondria and DNA necessary for the birth of child. The lower part of the head is called neck, and then the body. Finally, the in part is called trial. Let's explore the possible abnormalities in the sperm. Observing the image, if the head of the sperm is small or large, absent, or if there are two heads indicating abnormal head size and shape, we move forward the neck. If the neck parts thin or if there is any abnormalities in the neck region such as thickness or any other unusual condition. Now let's discuss about the trail. In this case, the trail is small or large, or if there are two trails, then these are considered abnormal. Generally, in the healthy sperm, more than 14% of sperm should have normal morphology. If the percentage of healthy sperm with normal morphology is less than 5%, is referred to as teratospermia. In the report, if there are no normal sperm observed, it means azoospermia, which indicate infertility or high rate of infertility. After that, we look at leukocyte, which is a component of blood and is referred to as pus cell in the some reports. Normally, the number of leukocytes in healthy semen should be less than 1 million. If someone has more than 1 million leukocytes, it is called pyospermia, which is usually caused by an infection. If the quantity of significant increase, it can contribute to infertility. Lastly, we examine the round cell. Normally, it takes a few days for sperm to mature. The presence of round cell is indicate the quantity of immature sperm in the semen. Normally, the number of round cells should be less than 5 million. Finally, in the impression or comment section in the report. If the comment section say normospermia, it means your report is normal. However, if you see hypospermia, oligospermia, teratospermia, asthenospermia, asthenosteratospermia or anything other than normospermia, you should seek advice for a doctor. Even if your partner doesn't have any issue without an adequate quantity of sperm, pregnancy won't occur. If any problem arises in the report, you should retest after 1 month. If the problem persists during the second test, you should consult a doctor. Hope today's video was helpful for you. If you find the video helpful, don't forget to share with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos. And remember to be a member of our family. Stay with us healthy and safely. Thank you for watching this video.